Welcome and thank you for joining part one of Seyfarth's micro-webinar series, Half an Hour for Healthcare. All participants are in listen-only mode, but are encouraged to submit questions throughout the program through the Q&A section located on the right side of your WebEx window. We will do our best to get everyone's questions. For those interested in CLE credit, an attendance verification code will be read during the presentation. Please write this code down. It will not be repeated and is required for CLE credit. Copies of the webinar recording and presentation materials will be distributed to attendees in the days following the webinar. At this time, I'd like to turn the program over to Philip Ebsworth.
Yeah, good morning, everybody. My name is Philip Ebsworth. I'm a partner here at Seyfarth Shaw in our Sacramento office, and thank you so much for joining us on our first part of half an hour for healthcare this year. And today we're going to be talking about regular rate pain points. So like I said, I'm Philip Ebsworth. I'm a partner in our Sacramento office, and today I'm joined by my colleague Lila Wild in our San Francisco office.
Hi, everybody. I'm Lila Wild. I'm a senior associate in Seyfarth Shaw's San Francisco office. And, like Phil said, we're going to be talking about regular rate in the healthcare space today, which is maybe not the most interesting of topics, but certainly an important one, which we'll talk about today. So we can jump into the slides and get going. First, I think it would be helpful for everybody if we did sort of a broad overview of the regular rate of pay. While most California employers are familiar with the regular rate from calculating non-exempt employees' overtime payments, the applicability of the regular rate doesn't stop with overtime. The regular rate is also the rate of pay for California paid sick leave, meal and rest periods, and also reporting time pay. Regular rate super important because litigation alleging claims for the miscalculation of the regular rate is frankly running amok. There are a huge number of class action and PAGA lawsuits pending, and it seems they're nonstop and ever increasing. These lawsuits are expensive due to California's statutory framework regarding penalties and the underpayment of wages for a class and representative group of employees dating back 1 to 4 years. So this is one of many reasons why it's so important, just because it can be a massive expense for the company if litigation ensues. And continue to speak about litigation, healthcare employers unfortunately are primary targets for these lawsuits because employees in the healthcare space, it's well known to plaintiffs' counsel that they generally are subject to many different premiums. They receive different bonuses, shift differentials, on-call pay, and more, all of which is a consideration for the regular rate of pay calculation, which we'll talk about. So because healthcare employers tend to have many more different pay codes in use for their non-exempt employee population, many of which should be included in the regular rate of pay, like I said, it makes it super hard to get right. It's hard for payroll systems to get it right, and thus very easy to be subject to one of these lawsuits, which can be, again, very expensive. So going on to the next slide, what is the regular rate? The regular rate is the weighted average rate of pay of all forms of pay for work performed by a non-exempt employee in the work week. It's a pretty loaded sentence. We'll break it down today, but basically it's nearly all forms of pay that are in exchange for work performed. All of those forms of pay must be included in the regular rate. If the pay is something, so another way to think about it is if the pay is something that the employee is anticipating as compensation for the employee's performance of work, it's very likely it should be included in the regular rate. This number, this total, is divided by the total hours worked by that employee in the work week. And there are some statutory exclusions for sure to the type of remuneration that must be included, and we'll talk about those later on. So what this means is that where a non-exempt employee earns compensation in addition to their base rate, the regular rate of pay will be higher than the employee's base salary rate. And it's this higher rate that is the amount that's paid for overtime, double time, so that 0.5 or 1 premium, California paid sick leave, meal and rest period premiums, and also reporting time pay. So going on to the next slide, and to break it down a little bit further, because it can be confusing even for those of us who deal with it on the day-to-day. To calculate the regular rate, you really need to know 3 things. What is the non-exempt employee's work week? Meaning, what period of time are we looking at their compensation and hours worked? what compensation needs to be included in the numerator and what hours need to be included in the denominator. Now I'll pass it on to Phil, and he can talk through some of the other pieces of the regular rate calculation in greater detail.
Yeah, so like Lila said, this is an incredibly important issue in our current climate, particularly in California because of our statutory framework out here with PAGA and the penalties on everything from wage statements to just unpaid wages generally. But this is also an important concept to get right because it's applicable nationwide as well. Employers outside of California still have to pay overtime and double time according to the regular rate. And so this is something that is critical to get right across the board, whether you're an employer only in California or across the country as well. So the regular rate has this reputation of being an incredibly complicated topic. And frankly, a large part of that comes from people's general anxiety around math. If there's one thing I want you to take away from the webinar today is that the math involved in the regular rate calculations is not complicated. It's just one big fraction that your calculator can do. What we have to do as lawyers and HR and payroll professionals, we just have to make sure that the numbers that are going to the top and bottom of that fraction are right. And then we let and that's not really the math of it. You know, we're just figuring out what numbers to put into the calculator. And that's kind of where this nuance comes in. So the first thing that we want to find out, if we move on to the next slide, is what period of time are we looking at in finding an employee's compensation that they earned and the hours that they worked. And so the general rule is that an employee's regular rate is confined to a particular work week, so a 7-day period. So that would mean, for example, an employee could have 52 different regular rates across the year. There's 52 separate weeks where the calculation could be different. And what you would do is you take all the compensation that they earned that week and divide it by the total number of hours that they worked that week, and that would get their regular rates of pay. Now, in healthcare in particular, there are a couple of things that we need to make sure that we're looking out for at this first stage of figuring out a regular rate calculation. First, there may be employees whose work week does not start and finish at midnight at the end or at the start of the work week. For example, night shift employees might have their work week set up so that it ends at, let's say, 8 a.m. on a Sunday or starts at 5 p.m. on a Monday. In that case, for those night shift employees, the time period that we're looking at to see what compensation they earned and what hours they worked would need to be adjusted compared to, let's say, a typical work week that might start on midnight on a Monday and end on midnight on a Sunday. And because of that, that typically means in our healthcare settings that there are different quote unquote work weeks to look at across the entire employee population. Different positions, different shifts might be operating on different work weeks. And so in that case, we need to make sure that the right work week is being applied to the right employees so that we're correctly calculating their regular rates of pay. Another wrinkle we see sometimes in healthcare is for employees who are on an 880 schedule. So under the FLSA, hospitals are permitted to have employees work an 880 schedule, which consists of a 14-day work week, so a two-week work week. Now, for these employees, their regular rate calculation, you would be looking at the entire 2-week population, which can often be the entire pay period. And so when you're looking at what hours they worked and what compensation they earned, you'd not be looking at just that a single week. You'd be looking at the entire 2 weeks in putting the numbers into the fraction to find the regular rate of that employee. And so, for example, these employees could have 26 different rates across a year rather than the full 52. But again, not every employee can be or even should be on an 880 schedule. So we need to make sure that, again, the right work week is being applied to the right employees in our payroll systems to make sure we're calculating the regular rates correctly for each individual employee. So if we move on to the next slide, let's talk about compensation. What are we putting into the top number at the numerator in our fraction? This is typically the more complicated aspect of a regular rate calculation. But again, it's not the math that's complicated. It's trying to figure out what compensation needs to be included. So if we turn to the next slide, First of all, the first thing that needs to go into this number is any kind of premium pay. So shift differentials, hazard pay, preceptor pay, all of these go into the number on the top of our fraction. What we don't include in terms of premiums is an overtime premium, for example. A general rule of thumb, and again, say general, there are exceptions to this, but a general rule of thumb is that if it is a premium or a pay that is paid at the regular rate itself, it doesn't need to go into our regular rate calculation on the top. And part of that is kind of a logical sense, because if you had to put it into the fraction to find it in the first place, we'd be stuck in this never-ending loop of math that doesn't make any sense. So those are kind of the premium pays that do go in. And what we don't include in terms of premiums is things like the premium pay for weekends and holidays, because the regulations under the FLSA, they explicitly exclude these as long as they're 1.5 times the employee's base hourly rate. And so what, in terms of bonuses, if we turn to the next slide, the things that we include in terms of bonuses are generally most bonuses, but certainly not all. Again, the general rule is that if the bonus incentivizes better, more, or more efficient work, it should be included in the regular rate calculation. If we could turn to the next slide, Brenda. So that would include things like seniority or retention bonuses and attendance bonuses. Those are all viewed as things that would incentivize better, more, or more efficient work. And so they should be included in that top number in our fraction. What we don't include is truly discretionary bonuses. So these are not as common as you may think. These are things that are truly, there is no expectation that an employee could have that they receive these bonuses. So think of just kind of a on the spot kind of bonus issued by a manager for a good job, for example. Other things we don't include in this in terms of bonuses are gifts and percentage of earnings bonuses. Now, this is a whole other topic that we don't have time for today, but this is a really good way of being able to provide employees bonuses without having to have the regular rate complications, is if you focus your bonuses based on a percentage of earnings rather than any other kind of metric. And again, that's kind of the same logic, because they've already received the regular rate pay. You don't need to include it again in the calculation to calculate the regular rate. And last of all, the other kind of big bucket of things that we don't include in our compensation are things like contributions to benefits plans or retirement plans, those profit share plans, those kind of things. Those can be excluded from our top number, our top fraction. And so once we've got the total compensation done in our numerator, the top number on our fraction, we can turn to look at what hours need to be included, and in the denominator, the bottom number in our fraction. If we turn to the next slide, Brenda, or actually 2 slides. So basically, what we want to include in this bottom number is anything that is actually work. So think like work hours, education time, controlled standby time, anything where the employee is actually working. Brenda, if we could go 2 slides. Great. And what we don't include is we don't want to double count hours. And this is something that we sometimes see. So if an employee, for example, works a 12-hour shift, the total hours that are to be included on that workday is just the 12 hours. We don't want to also include any hours they got paid overtime or hours they received a shift differential, because that's all encapsulated in like the 12 hours they worked. They worked from 12 p.m. to 8 p.m. Those are the hours they worked. Those are the only things we're putting in this denominator. We don't want to we don't want to double count those hours, even if they're receiving multiple different types of pay during that time. So there might be more than 12 hours listed on a pay stub, for example. We don't want to be double counting those hours. We're then like shrinking the employee's rate of pay, and that's just going to attract more issues because we're essentially underpaying these employees. We also don't include things that aren't work. So things like meal and rest period premiums. This is a good example of something paid at the regular rate that we don't put into our regular rate calculation. Also things like reporting time pay, which again are more common in the healthcare industry than we see in other employers. Those are sometimes mistakenly thrown in because they're kind of viewed as compensation for work. But again, the employee is not actually working to receive that compensation, so it shouldn't go into our denominator. And also vacation and sick pay, for obvious reasons, they're not actually working during this time, so it doesn't go into our denominator to figure out what the employee's regular rate of pay is. And if we turn to the next slide, before I hand back to Lila to talk about some of the pain points in particular we see in healthcare, I wanted to briefly note the wrinkle that in regular rate that is flat sum bonuses. So nearly 6 years ago now, the California Supreme Court decided in its infinite wisdom that flat sum bonuses must be factored into regular rate calculations differently compared to anything else. And that was different from what the FLSA regulations say. It was different from what the state of California said at the time. They decided there's a new way that you should be doing, you should be calculating flat sum bonuses into the regular rate. So flat sum bonuses generally are bonuses that don't increase in proportion to hours worked. So for example, if you get just a flat, say $100 for good attendance for the week, that number's not going to change depending on how many hours you did actually work. That would be an example of a flat sum bonuses. And for these bonuses, how we factor them into the regular rate is when we're counting the hours that goes in the bottom of our fraction, we are only counting straight time hours and not all the hours that the employee worked. So these are only the hours that the employee did not earn overtime on. And so that's just kind of like a flat sum bonuses in a nutshell. This topic itself can get a little bit sticky because it is kind of a little bit unusual and its own topic based on how the Supreme Court came down with it. But we don't have time to really get into the weeds on kind of how that might play out in various scenarios today. But if you do have questions specifically about flat sum bonuses, please do reach out to either me or Lila, and we'd be more than happy to answer your questions. But I'm going to turn back to Lila now, who's going to talk about some of the pain points that we specifically see for healthcare employers.
Thank you, Phil. Appreciate it. You can go to the next slide, please, Brenda, and probably the next slide as well. So talking about why all of this matters, we've said it probably 2 or 3 times at this point, but I am going to say it one more time, is this is a growing topic of litigation, especially in California, but everywhere. I mean, daily there are countless lawsuits, class action, PAGA lawsuits filed alleging regular rate claims. Sometimes plaintiffs' counsel have actually taken the time to look at their clients, the plaintiffs' wage statements, and actually figure out what the regular rate violations, if there are any, are. But a lot of the times they're not doing that. They're just saying, it's a healthcare employer. We're sure they have some violations. We're just going to file this lawsuit. We have a plaintiff that worked there, and they file it. That's the most common scenario, and they are a dime a dozen right now. And so for that reason, it's really important that healthcare employers, specifically in California, are getting it right so that when this lawsuit is filed, there are clean records, and we can show the opposing counsel very quickly that there is no there, for lack of a better term, and that's a really good way to refute those claims. They don't want to put time and ultimately their money into, trying to get a huge settlement from a case they're just frankly not going to get a huge settlement from. And that comes from having clean records and doing things right. It's really hard to get right. We've talked about it. Yes, the math is easy. I really love that Phil made that point. The math is ultimately easy. It's addition. And then there is a numerator and a denominator. We all know how to do those simple math procedures. It's really just knowing, okay, what goes into that addition formula, what goes into the numerator and what goes into the denominator. And once you really just kind of make a list of these things and make sure your payroll system is doing it right, then you get it right. It's just taking the time to make sure it is done right. And that's the hard part, right? It's confusing. There's a lot of elements to consider. And then if litigation ensues, specifically class action litigation, it's hard to refute the class claims on the basis of there being a lack of commonality, which is one way that you can sometimes refute class claims. And that's because pay policies relating to the regular rate are almost always applied in a really uniform manner. So we can't say, it was different for this employee than it was for this employee than it was for this employee, because generally a payroll system is doing things the same exact way for the entire employee group. And then going down to money, right? That's the bottom line for companies at the end of the day is money. How much is this going to cost? So maybe it's pennies in damages. Maybe if you're looking at an individual plaintiff or a small class of employees, you're like, oh, okay, they were underpaid 3 cents here, 10 cents here, and in total it's, a couple $1,000s. That's not usually where it ends because of California's statutory framework. We have all of these penalties that will also apply. So, Labor Code 203, it comes from the public policy in California that has long favored the full and prompt payment of wages due to an employee. So to ensure that employers comply with the laws governing the payment of wages, the legislature enacted Labor Code 203, which basically says that when an employer fails to pay all wages due at termination, they're liable for the payment of what we call these waiting time penalties to each employee who they failed to pay all wages due at termination, up to a maximum of 30 days. So if you're thinking of your class action, let's say you only have 100 employees. Sometimes you might have 12,000 employees, but for every one of those employees, you're allegedly liable for the payment of 30 days of wages to each and every one of them, in addition to any other penalties that might apply, like Labor Code 226 penalties or PAGA penalties. And there can also be other, PAGA penalties. I think of all the statutory frameworks in California, it's kind of this unique beast of California. It's the one that costs the employers in these types of lawsuits generally it's the worst. It's very expensive for employers, because PAGA allows an employee to file a civil action against an employer for the recovery of civil penalties for violations of various labor code provisions, including regular rate. And there are these penalties that are applied. So PAGA penalties are assessed against the employer in the amount of $100 per employee for the first violation. And then for subsequent violations, $200 penalty for every single pay period worked for every single employee. So as you can see, when you start looking at those, when you're looking at it per pay period, it very quickly becomes incredibly expensive. And so that obviously is a huge pain point of these regular rate lawsuits, but also why it's really important to get the regular rate calculation right. You can go to the next slide, please, Brenda. So some advice, be proactive. Obviously, you're here today. That's the first step. You want to understand it. So don't assume, I think the first thing is don't assume that your payroll provider is getting it right. While that would be a great assumption to be able to make, it's not often the case, because payroll providers need, well, especially for the healthcare space, they need specific instructions. The healthcare industry often utilizes more pay codes than the normal employers. So the regular rate calculation and how different categories of pay appear on the wage statement isn't always easy or common knowledge for the payroll provider. So, we would recommend that you're really hands-on with your payroll provider. You're walking through what is included in that regular rate calculation, what is in the numerator, what is in the denominator with your payroll provider. You're making sure all the right pay codes are included where they should. And then also another piece of that, there's not specifically related to a regular rate claim, but related to another claim that often comes with it, is a wage statement claim. So making sure that all those pay codes and the calculations are appearing on wage statements correctly. So, and then also, I think another thing to do is do an audit of payroll codes. Make sure they're configured correctly. It's technical and it takes time and understanding, but it's super important. So this is done with the payroll provider, but also internally with your payroll team. There needs to be a clear line as to what codes are included in the regular rate calculation and what are not. And, often healthcare employers have non-exempt employee populations that are working on different work week schedules. So you want to make sure that these work weeks are considered in the regular rate calculation for each employee group so that the regular rate and overtime, California paid sick leave, et cetera, are being paid correctly. You can't just create a scenario internally and with your payroll provider where every employee's regular rate calculation is paid based on the same work week. So when we are talking about the denominator of that equation, what is that employee's work week? So that would be our advice. I think the biggest piece of the advice is be proactive, be hands-on, make sure you're walking through the calculation, that things are being done right. And not just that, there's an understanding internally in that there is, you think it's being done right internally, but is that communication getting to your payroll provider? Are they doing it right? And so such that the employee's payment of wages is actually correct and that it's showing correct on wage statements. So that's our little 2 cents of advice. And then, I think the last thing is ask the question. You can reach out to me, you can reach out to Phil. There's many other resources too here at Seyfarth Shaw. And, just make sure if you have a question, ask it. Because not asking the question, it's not just you don't know the answer in this case, it can be super expensive for the company. Right? And we all want to make sure our employees are getting paid the wages that they are due. So litigation doesn't ensue, but also just because that's the right thing to do, right? And now we have a little bit more time, I think. So we'll go through a couple question and answers that are kind of unique to the healthcare space that might be, bubbling up inside of you. But if not, you guys can also ask other questions either in the chat or afterwards to us.
Yeah, so before we cover some of the more common questions we get from healthcare employees, one thing I wanted to add to Lila's point there, not only is it important to do an audit of like how your pay codes are and your regular rate calculations are currently being done, it's very important as well to make sure that there are processes set up within your payroll or HR departments for when you introduce new pay codes. It's not uncommon that we have the business wants to introduce new bonuses or new incentives. Make sure that there is a process set up to ensure that when these new pay codes are being added, that they're being added into the payroll system correctly, so that the regular rate is still being calculated correctly. In the same vein, making sure there's a process for when employees maybe switch their schedules around, so that they move on to an 880 schedule, for example, and all of a sudden you're looking at a 14-day work week rather than a 7-day work week. Ensuring that there's a process in your payroll departments to capture these events that would have an impact on the regular rate calculation can really be invaluable. I know it takes time to set up these processes, set up these systems internally, but like I said, while underpayments may be pennies or dollars, it is not uncommon to see the actual, potential exposure or liability on these claims be 150 to 200 times more what the actual underpayment is. So it is very important to get these things right. Now, in the last 2 minutes, I've seen there's a bunch of questions that have come in through the Q&A. A lot of those are very specific to, I think, your guys's scenarios or situations. Lila or I will get back to you. We have your emails and we have your questions. We'll be sure to get a response to you rather than taking up everybody's time now with your very specific questions, but we will get back to you this week or in the coming days. But real briefly, I want to cover what we have as some common questions. One we get a lot in the healthcare industry is the unionization. Employees, whether it be nurses or anybody else, are in a union. Do you still need to worry about the regular rate? Yes, absolutely. There is no CBA exemption from overtime under the FLSA. And whilst there is some CBA exemptions in California, it doesn't generally apply to paid sick leave, nor would it apply to meal and rest period premiums, which will have to be paid at the regular rate still. And next slide, Brenda. Another FAQ we get is about what about the folks who are non-exempt but salaried? I mean, that's not uncommon to see in the administrative departments of healthcare providers. Do you need to still be worrying about regular rate of pay for them? Again, yes, absolutely. While salaried non-exempt employees we're not paying them quote unquote on an hourly basis. They are still subject, as a non-exempt, still subject to the same overtime requirements. And so they would need to be paid overtime as well as all the other things like meal and rest period premiums, sick pay at the regular rate of pay. Let's do one more. I'll squeeze in one more FAQ before we end today. Employees who receive uncontrolled standby time, does this need to be included in the regular rate calculation? Standby time could be its own 30-minute webinar. It's always been something that has been a hot topic in the healthcare industry. But yes, any compensation that an employee receives for uncontrolled standby time should be included in that top number in our numerator for the regular rate. But because it's uncontrolled standby time, they're not, under the control of the employer during that time. Those hours should not be included in the denominator. I'm being told we're out of time, so I'm going to ask Brendan to scroll really quickly through to our CLE code. And this is our new process for CLE. If you scan the QR code, we'll leave the slide up for a little while, and that will send you to the verification form for CLE. And Lila, could you read out the CLE code for us?
Yeah, it's Seyfarth Shaw 5682. Sorry, SS as in Seyfarth Shaw 5682. So SS 5682.
And so we'll leave that slide up for a little while, but I want to thank you all again for attending. I know that it's really hard to cram a topic like regular rate into 30 minutes, but really appreciate you all coming to listen to us today. We'll respond to those folks who sent questions. We'll get back to you as soon as we can. And to those of you who still do have other questions, feel free to email either myself or Lila, and we'd be more than happy to walk you through this topic that we all love so much. Again, thank you so much for your time today.
Thank you, everybody.